The 2015-16 Zika outbreak in Brazil put the spotlight on the issue of neurodevelopmental disorders in children. The prevalence of such disorders is increasing, and so are the challenges to integrating their identification and management into present healthcare systems. In November 2017, the Academy of Medical Sciences, the Brazilian Academy of Sciences, and the Brazilian National Academy of Medicine hosted a workshop for international pediatric experts to discuss the issue and identify next steps. The workshop observed that the current epidemiological understanding of neurodevelopmental disorders in Brazil is imperfect, and high mortality rates and stigma often lead to underestimations of prevalence. In light of Brazil's record of successful centralized initiatives, the workshop evaluated existing strategies regarding Zika, childhood disability, and neurodevelopmental disorders. While it found examples of good practice, these were not comprehensive programs. From the discussions, the workshop proposed a series of next steps. A situational analysis of resources available would result in the identification of key gaps in the system and help prioritize action required. Engaging with internal and external funding bodies and taking advantage of specific funding avenues would address the shortfall in health research expenditure. A centralized evidence base built on existing centralized systems would help determine the efficacy and cost-benefit of interventions. Integrating clinical data at a local level would also be an initial step towards developing a national database for pediatric neurodevelopmental disorders. Increased specialist skills training is required, as well as additional training of non-specialists to prevent a reliance on physicians. Improvements in the identification and assessment of children with neurodevelopmental disorders are needed, specifically to consider issues such as quality of life. The workshop also advocated combined interventions at community level and suggested the education system be used as an engagement platform to meet the holistic needs of young children. To find out more about our work, visit our website.